Dr. Izon, here to talk about sponge knee. That's what I call osteoarthritis of the knee. So the layers in between the bones of your knee are protected from each other by a nice fluffy cartilage that usually is pretty supple and is pretty thick and holds together well. The challenge is as time goes on, as we all know, gravity never takes a day off, and life's all about bad mistakes, and if you get trauma and other things to your knee, your sponge can become like this old brittle sponge. It's thinner, it's just not as compliant or fluffy, and then parts of it can break off. And similar to when your eyes get irritated, they tear. If your cartilage gets irritated and tears, those tears, quote unquote, have no place to go, and actually that's how you get water on the knee. So this is a problem that we see from having too much activity, otherwise known as osteoarthritis, or what I call sponge knee. So with osteoarthritis of the knee, the main three parts we're looking at, or the different compartments, are the inside part. If this is on the outside, this would be the medial side, this is the lateral side, and then underneath the kneecap. These are cushioning, they're the cartilage, and they actually, especially when you bend, really put a lot of stress on the back. So you'll notice with osteoarthritis, you'll have a lot of back of the knee pain, but also on the side. And most of the time, this is a right knee, the pain will be down into here. So if you have a lot of pain down in here, think about osteoarthritis. What's the cause of osteoarthritis? Weight gain, too much activities, especially if you're a heavy runner. Running downhill. Amazingly, downhill running is 6 times your body weight. So if you're, say, a 150-pound person, that's quite a bit of weight. Trauma, if you've had previous car crashes or bike crashes, previous surgery, especially surgical arthroscopy. Family history of osteoarthritis, as well as if you're a smoker. One of the ways to diagnose it, obviously, is the history and then the physical examination. You're going to have pain around the knee, and you're going to have a lot of swelling sometimes. There'll be stiffness, and especially when you're trying to do bending. We might have to do x-rays, might have to do MRIs. How do we treat osteoarthritis? Start with the basics. You want to avoid activities that irritate it. If it bothers you to run and jump, just cross-train and go into cycling or swimming. Consider getting your ideal body weight. Weight loss can be done very easily, but sometimes it is a challenge with nutrition. Ice is good. You can do it up to 3 times a day for 15 minutes. A lot of times I recommend ice it with water-based ice right before you go to bed. Cycling is the best thing. You don't necessarily have to use a lot of resistance, but high-speed spinning or indoor cycling is quite good. Smooths the cartilage, actually gives it nice massage that'll move the nutrition around, as well as you can use it to help balance all the muscles. You can use various medications. There's straight Tylenol, acetaminophen type. You can use the anti-inflammatories like Advil, Motrin type. You can use straight pain medicines, as well as there are some other medicines that are more sort of topical. The one thing that I really like these days is the osteoarthritis brace. If you have a bad side, you can use a brace that kind of pushes it and gaps it so that you're right on the good cartilage. Finally, you can do home exercises as well as formal physical therapy. There are various injections. You can start with steroid injections that will help with the inflammation. There are injections that give you supplementation in terms of viscosity or lubricants. And finally, the newest one is platelet-rich plasma, or PRP, under ultrasound guidance, that has the potential to regenerate your cartilage. And finally, rarely, you can get a arthroscopy. You can even do a knee replacement. So remember, if you have sponge knee, there's things we can do. Let us know if we can help. And remember, ease on down the road to good health.
Check.